sort of out of necessity. One of the things that happens is a lot of folks don't get service in the area of wound care, and I'm a vascular surgeon, so one of the things that occurs is patients come to you with a hole in their foot and they might need a vascular procedure, but they're actually there for the hole in your foot. So unless you can get somebody else to help you with taking care of that hole, then you're sort of stuck with, yes, mom's circulation's better, but she still has the hole in her foot. So we ended up with a lot of patients who needed wound care, and no one really in the vicinity, believe it or not, to do it. We have the Vascular Conference weekly, and certainly when I go back to the facility, we usually discuss that. One thing that's not happening this year is I usually have my senior nursing staff with me as well, and that we can kind of pass that along on a daily, day-to-day basis in the clinic as well. But we discuss it with both the resident teaching and with the staff in the facility teaching as well. You know, certainly over the years, a lot of things get brought up here that need some more work and to be better figured out, but because there's so many people come together to discuss topics, examples of that would be things such as biofilms, which certainly over the last 5 years or so have had an awful lot of discussion with still sort of not enough research done on them. Historically, things like the use of silvers, even more historically, maybe negative pressure wound therapy, and various items that have had some clinical traction but needed more scientific insight or research or clinical outcomes. And every year I find something new here. The general construct of us is we're a vascular surgery group. We certainly work with infectious disease doctors as well as working with podiatry as a group and consulting group. We actually, one of the odd portions about Manhattan and New York City is there are actually no true wound care centers within that geographic area, which is a little odd. But with that in mind, we don't have a well-structured component yet where everybody can all be in the same center at a given period of time because of size constraints. But so we are multidisciplinary, but we're not quite as well organized in that area as we'd like. I think one of the things is that we're more driven by clinical algorithms of care now. Many of those have been based on clinical research outcomes that we've had over the history of our time doing this, so that we try to fit patients into structured clinical algorithms, and we have much more structure into how we move patients through the clinic itself. It's much more organized. The patients probably receive a better experience, and we're getting a little bit better organized at delivering their home care as well, which in a city such as New York can be relatively daunting. One of the things we do with new products, obviously, is try to figure out, are they really new products, and is also an area of need or knowledge that needs to be filled about that. So I do a lot of clinical research, so often I'll try to figure out if it's a product that actually has real clinical research behind it and possibly bring it in as a trial product with meaningful clinical research. If we find it to be something that is a niche product, it's easier to bring in and just use and get sort of a smaller sense, but sometimes we really want to be the people who deliver real clinical outcomes research about the product prior to using it in the facility. Well, I think there's obviously continues to be more and more material out there, and unfortunately somewhat even more and more confusing at times. And you really try to figure out what the differences between them are and how they make sense to use on your patients. Some of those things can be economic in nature, etc. Obviously, we're looking for things that allow the patients to heal quicker and have a better experience. And obviously, those products become better and better engineered over time. Well, I think definitely what I think of as the spring SAWC meeting is probably the premier meeting for folks who are interested in wound care in the United States. And I think they should come here to get a good idea of what's going on. I think that the nice part about the meeting is the clinical track pathways, where people with differing backgrounds can come to the same meeting, possibly from the same center, such as mine. I can have a nurse, myself, I can have a resident, who I have here now with me, and I could have a medical office assistant, all, for example, all get good, meaningful information out of the same meeting. And that's pretty rare for most meetings. Most meetings really cater to one level of expertise, and this meeting does a great job of catering to a whole group of people.